Hi everyone! Welcome to OCD Awareness Week. My name is Emily Bailey and I'm a licensed clinical psychologist practicing in Atlanta, Georgia. Today I'm really excited to introduce you to some of the members of the Faith and OCD Taskforce, as well as tell you a little bit about a subtype of OCD known as scrupulosity. Individuals with scrupulosity have intrusive thoughts that latch onto their faith and beliefs, and in response to those distressing thoughts, they engage in compulsions that are sometimes misinterpreted as devout practice. In other words, OCD is really trying to hijack their faith and have them practice in a way that's extreme and not like normal faith practices. I'm going to pass you off to another Faith and OCD Task Force member who has seen the band Rush in concert 30 times.
Hello, I'm Dr. Patrick McGrath. I'm the Chief Clinical Officer at NoCD, and my OCD truth is scrupulosity is not a faith or religious issue. It's an OCD issue. Keep that in mind. Now I'm going to pass it off to somebody who has 15 grandchildren and loves hanging out with them.
Hi, my name is Annabella Hagen. I'm a licensed clinical social worker, clinical director, and founder of Mindset Family Therapy. My OCD truth is that when religious scrupulosity targets someone's faith, they can learn to trust that their God will strengthen them during treatment so they can truly enjoy their faith. Now I'm going to pass you to a person who loves perfecting a homemade latte.
Hi, my name is Mubina. I'm a licensed clinical social worker in Redondo Beach, California, and I specialize in the treatment of OCD. My OCD truth is that OCD is an unhelpful helper, and it will use every trick in the book to get you to pay attention. You can work towards giving it less attention and move into a more values-driven life. I'm going to pass you on to a person who won a trophy on a cruise ship for a dance-off. We know what you're thinking, but he was only drinking water.
Hi, my name is Justin K. Hughes, licensed professional counselor. I'm a cognitive behavioral therapist in Dallas and a writer specializing in OCD and anxiety disorders. And my OCD truth is that the integration of faith concerns in treatment is not only desired by many, some studies show most clients, but it's oftentimes highly essential, especially when we deal with themes of OCD like scrupulosity. In fact, in scrupulosity, there's an associated lower level of insight related to the theme, related to the religious belief, practice, spiritual belief, morality, etc. As people feel confusion over whether it's obsessional or not. And getting competent support in treatment is crucial. Now I'm going to pass you off to a person who loves nature, especially trees, and hugs them all the time.
Hi, Valerie Andrews, lead advocate with the International OCD Foundation. Listen, my OCD truth is this. I'm a 67-year-old Black Christian woman, but I'm here to tell you OCD does not discriminate. It cares less of my age, my color, or my faith. But I'm going to pass it over to someone who thinks Meghan Trainor is the most underrated artist of all time.
I am Caitlin Claggett-Woods, a clinical psychologist based out of Ottawa, Ontario, Canada. My OCD truth is God doesn't want you to have OCD, so why wouldn't He support the treatment that you need to recover from it? Now I'm going to pass it off to somebody who just released their book, When Religion and Morals Become OCD, Understanding and Treating Scrupulosity.
Hi, my name is Leslie Shapiro. I'm a behavior therapist at the OCD Institute at McLean Hospital in Belmont, Massachusetts. I've had a special interest in treating scrupulosity and moral perfectionism since 1989. The important thing to remember is that scrupulosity and moral perfectionism are not virtues. They are motivated by fear and the need to feel right. Healthy faith and morality are practiced out of love. In 1957, Richard Kilpack made the statement, "The opposite of a scrupulous person is not an unscrupulous person, but a person of faith."
Hi, my name is Katie O'Dunn. I'm an ordained minister and interfaith chaplain, open about my own experience with OCD. And one of my favorite things is serving alongside these amazing humans you just met on the Faith and OCD Task Force, who have helped create our Faith and OCD resource page, conference, and so many other amazing IOCDF initiatives that highlight religious inclusion and cultural responsiveness. My fun fact is that my favorite thing in the world is running 30-mile races in the woods on trails as I keep running toward my values, regardless of what OCD throws at me. And the OCD truth I would like to close with is that engaging in OCD treatment doesn't oppose faith, but it can actually help folks reconnect with religious and spiritual practices in value-driven ways, in meaningful ways. Thanks so much for tuning in and meeting your IOCDF Faith and OCD Task Force.